Hello, everyone. Welcome to the Q&A session with Monique Sager. She is a dual degree MD/MBA candidate at the University of Pennsylvania's Medical School and the University of Pennsylvania's Wharton Business School. So Monique, do you want to just do a quick introduction of yourself?
Sure, Elaine. Hi, guys. I'm Monique. I would love if people could turn their video on. It'll help this session be a little bit more interactive. It'll be great to get to know you. So I'm just going to kick it off by telling you a little bit about myself. I've had some really fantastic questions come in over email about what an MD MBA is, why you choose that. And I think giving a little bit of my background might be helpful to you guys. So I went to University of Pennsylvania as an undergrad, graduated 2015, and I majored in history and sociology of science and technology. So not pre-med even remotely. Med school was never on my radar. I thought it would be honestly like way too challenging. And I was always more of like a history and languages person. My junior year, I took a class on medical technologies, loved it. And it put the idea in my mind that maybe I might want to do something in the healthcare field. And then I did research throughout my senior year on changing technologies involved in childbirth. Really liked that, had already signed a consulting offer at that point, which is the classic career for those who kind of don't know what they want to do. Went to consulting, quickly realized, no, I really have to work in healthcare. I felt that I had to do something that was really meaningful for the world. So I went to Flatiron Health, which is like a big health tech company. And I loved, feeling like I was doing good for the world. I was working with cancer patients. It was so interesting and cool, but I still felt like I was missing something. And I kept coming back to the thought that I really wanted to treat patients and I really wanted to be someone's direct clinical advisor. And in healthcare, there's kind of a lot of ways one can make a difference. You can either be one-on-one as a clinician, or you can be one-to-many as someone who works in, public health or healthcare consulting, things like that. And I decided that for me, one-to-one was really the way to go. So then I went back. I did a post-bac program, took all of pre-med in 1 year at a different university, then matriculated to Penn's medical school. And after 3 years in medical school, I then applied to business school. I was still hoping to combine all my interests. And I'm now in my second semester of Wharton, where I'm a dual MD MBA student. And one point of clarification here that I think a lot of people have asked over email, I am not in an official joint program. I, like most MD MBAs that I am friendly with, just literally applied to an MBA program after 3 years of medical school. I can't speak to like how it works in Canada, but I think that is pretty much the predominant model in the US, where like you're already a medical student and then you apply to your MBA. Anyways, why am I doing the MBA? I've already told you guys I want to be a clinician. I'm going into psychiatry. Just love mental health and working with specifically women. One-on-one, I'm doing reproductive psychiatry. So things like postpartum depression, postpartum psychosis, infertility. But I still had this really strong interest in digital health. And I also knew that I was going to not work for a hospital system, but rather own and run my own clinics. So traditionally, doctors don't have much of a business background. And yet, when you hang your shingle and make a private practice, so many of the decisions that you are making on a daily basis are financial ones. And I was really interested to learn accounting, finance, negotiations, management. And I thought that even if I didn't end up running a private practice, I still wanted to work in the digital mental health world. So I am currently doing that while I'm an MBA. I have been a clinical advisor for several startups, which is really, really rewarding. And I can tell you guys more about that later if you're interested. And I'm about to start working with a venture capital firm that specializes in digital health companies. I'm working sort of with them and for them for one of their mental health companies to help get it off the ground and running in sort of a clinical and just advisory capacity. There's basically, there's a lot that you can do with these degrees. They're both really wonderful degrees that open a lot of doors for you. So that is me. And I think I already addressed the first question I had, which was people had asked about joint programs. And the first question was, what led you to pursue a joint MD MBA program rather than any other joint program, such as a combined MBA or PhD? PhD never in the cards for someone like me. As I mentioned, humanities person, horrific at research, no idea like what a stem cell, any of that is. I always had a sense that I wanted to go into business, and those were sort of like my two interests. So I decided to just combine them. And then the next question also sort of led into this. Would you recommend pursuing a joint program? I don't know of any joint programs. Maybe it's different in Canada, but I can't think of one like program where you apply to get your MD and your MBA at the same time. So if there is one and you knew that's what you wanted to do, I mean, why not? Go for it. The biggest downside, honestly, of taking time out of medical school to do your MBA is the cost. It's extremely expensive. You have to have a lot of confidence, I think, that it's going to pay off for you. And that was the big deciding factor for me. Like, do I want to incur $150,000 extra dollars on top of how much medical school costs and put myself in more debt? But I decided that based on what I wanted to accomplish in my career, it made sense for me, and I thought it would pay itself off. And I also did get a few scholarships through the medical school, through the business school, through a family foundation that I applied to. So that really helped. The next question was, what careers cater to an MD MBA program? So there's so much you could do with this. I'm going to go off the assumption that if you're pursuing an MD MBA, you actually still want to practice medicine and you want an MBA as your like extra cherry on the top thing to help you also dabble in the business world. And the reason I said that assumption is there are people who go to medical school, decide like their second or third year, you know what, clinical medicine is really not for me, and then go get an MBA. I think that's the minority. And I think I will say, like, you want to be really, really, really sure that you want to do medicine before you actually start medical school. Huge advocate for taking 1, 2, 3, 4 years out. Not only does it make you a better candidate, because med schools prefer a more mature candidate, but it makes you maybe a more well-rounded person. You kind of know who you are, you've worked, you have a sense of what you want to do in the world. So I think the people I know who took time off never ended up in that situation where they got halfway through medical school and said, "Ooh, I don't really want to do this." And they had worked a little bit before. But careers, I think the sky's the limit with an MD MBA. You could do a lot of things. So you could do hospital management is a really popular route. Like, did you want to be the head of cardiology? Well, you might want to know how to manage teams. You know, you might want formal training in like how do people work best together? How do you negotiate salary, negotiate a raise? These are things that nobody is going to teach you in medical school, and that are really helpful lessons that you learn in business school. You could also do things like medical devices. Like, you could work part-time for like Medtronic is first example that comes to my mind. They have a lot of cardiologists on staff. They have a lot of other medical adjacent folks. You could work for big pharma. A lot of MDs, specifically MD PhDs in Pfizer, Regeneron, all these big companies. There's always a door open for you in pharma. That is much more on the research side, as far as I can tell from the folks I know who have gone that route. And I don't know if they maintain a clinical practice at all. Could also maintain a clinical practice, and you could do what I said that I was interested in, like open a private practice. That is becoming increasingly rare these days. Psychiatry is one of the only fields that really has, at least in the US, I can't speak to Canada, that really has like private practice still as a prevalent thing. I think it's maybe 40% of psychiatrists still have a private practice. You could do public health. You could do health economics. You could do so many things. Oh, I'm getting some questions. Okay. What kinds of clinics, private practices are you planning on opening? So I mentioned before, I'm hoping to do reproductive psychiatry. So I will probably either have just my own freestanding clinic that really just addresses women's mental health, or I tossed around the idea of opening something that combines infertility services with the mental health aspect of infertility. So basically, like we would call that like novel clinic models, things like that. I think that anytime you're combining specialties, you're opening practices, that requires a lot of business acumen. Another question I got, can you make a comparison between a master's of business innovation versus master's of business administration while doing an MD? And is innovation or administration a more important aspect of business in the medical scope? I think, so I'm not really familiar with a master's of business innovation. Is this a common thing in Canada? Does anyone know? Seems like no one knows. Maybe
I've never heard of it before.
Okay, yeah. So an MBA is a really common degree. I can't really speak to a master's of business innovation. I don't really know what that is, but yeah, so I think I can't address that one so well. Let's see, we had some more wonderful questions. Oh yeah, a lot of people asked me specifically about my experience at the University of Pennsylvania, where I went both for undergrad and for medical school and now for business school. So some of the questions were, is UPenn a good place to go for pre-med? Why or why not? I was never pre-med at UPenn. It seemed really like intense and stressful from the people that I saw doing it. I think that is going to be the case probably at any, any good research school that you go to. Yeah, it intimidated me too much, so I didn't do it. But I think that UPenn is an excellent research university, as well as has an incredible liberal arts program. So for me, I was able to benefit from taking advantage of like quite literally like everything they offered, from business to humanities to languages to science. So yes, strongly loved it, recommend my experience. And then another question was, does UPenn have a good community? What's the community like? I thought it was a great community. It's huge, it's overwhelming. It's 10,000 undergrad, 10,000 grad. So people tend to gravitate into like affinity groups and interest groups, whether that be sports teams, fraternities or sororities, cultural affinity groups. Like any big school, you tend to make a smaller niche in order to carve out a place for yourself. I was in a sorority, and that was a huge part of my social component because that was like the group that I found and I enjoyed that. But I know people who, for example, were big theater people, and they were in all the theater groups. They had a huge theater community. I think as long as you find a community, then you're gonna be happy because you're gonna have your people. Let's see. What are good undergrad majors in the UPenn College of Arts and Sciences that one can pursue if they want to be a pre-med, but also have a backup in case they don't get into medical school? So I don't know how common this is in Canada, but it's pretty common in the US to not, like, you don't have to major in pre-med. We don't even have that as a major to go to medical school. And it's increasingly common to major in whatever interests you. This is probably my biggest piece of advice for you guys today. Major in whatever interests you, because you do better in life when you pursue what interests you. I think a common misconception that people have is they have to be a bio major in order to go to medical school, or they have to be an econ major in order to do business or be successful. That was not my experience at all. I worked in private equity consulting as a history major, and nobody once asked me about my major except to comment how cool it was. And now that I'm in business school, I can report safely back and tell you people majored in literally anything. One of my close friends here majored in geology and is now doing healthcare consulting. So while it can help prepare you for some of the things you may see, people love to see that you've had a genuine interest in something and you've pursued your own passions. I actually still use the lessons I learned from my history of science and tech major all the time. So I don't think there's any major that you need to go to medical school. And in terms of having a backup, again, like maybe if you wanted to work in public health, it could be really helpful to have studied public health, but if you're not interested in public health, definitely don't do that. Or if you majored in economics and studied health economics, that could be really helpful to you. if you wanted to get a job doing something, in that realm. But otherwise, if you want to go to med school, it doesn't really matter as long as you actually complete the pre-med requirements. Did that answer that question? Feel free to pop a message in the chat if you have more questions on that. I want to pivot now because several people asked about, and I think this is a really good question. How is the medical school workload? How much free time do you have, if any? So this is why I wanted cameras on. I wanted people to be able to raise your hands, but maybe you can do the virtual hand raise. I think you can hit like reaction or something. How many of you guys are worried about that? Like you're concerned that med school seems really hard or? Yeah, me too. Thank you so much for your honesty. Yeah, I was so intimidated by medical school, you guys. I was so scared. I was like, oh my God, I am literally never going to be able to do this. These kids are so smart. This is so crazy. So here is my experience. Penn has a 1.5 year preclinical curriculum, as opposed to the typical, again, caveat, at least in the US, I don't know how Canada works. Typical here is 2 years preclinical, 2 years clinical. So we did a 1.5 year preclinical. So it was an accelerated curriculum. So it was, I think, a little more challenging. It was fast. I think the first semester was, I felt like, okay, like maybe they're taking a, I can do this. But honestly, by the time we got to the second semester, I was failing things left and right. And I had never failed anything in my life before. I had always been a really, really good student. And I honestly had never even been a really hard studier. I had never studied so hard in my life. And then I kept failing everything. And then at first I was really isolated. I ended up co-founding Penn's academic resilience team. And the reason we created this group is because so many people in medical school go through the same experience, which is you were really good at school your entire life, and now you're failing everything. The reason is because when you get to medical school, you've taken basically like the top 2 kids in every class and you put them all in one place together, right? So anytime there's a curve, people have to filter out to the bottom, and you just can't be the top anymore, most likely, right? Statistically. So it was really great. That group is something I've been running for the past 4 years. We have a peer-to-peer support network. I'm mentioning this because I want you guys to be prepared if and when you go to medical school, for the reality that like one might not be doing so well academically anymore. You get your groove. It just takes a while. And it's a very common experience to feel super overwhelmed and like, this is so much. How do I do this? I was never pre-med, so I can't really speak to how it compares to pre-med, which is a question that I do get asked a lot. I thought, like, I did a post-bac, so I did all the pre-med classes. I thought those were much easier for me than medical school. The reason is when you take an undergrad class, it can be your whole focus, right? You can focus on orgo and only orgo. And in medical school, it's like taking 15 orgos at once. And so it's very challenging to kind of divide your time. That being said, I got 8 hours of sleep every night. That is something I have never and never intend to compromise on. And, the first 2 years were really tough, but I did it, and the great thing about medical school is it doesn't really matter. Like if you're at the top of your class, the bottom of your class, like you pass and you're an MD, right? Like that's how it works. Nobody ever asks you when you're in practice, like, were you the top 5 kids in your class? I thought it got way better when I got to clinical years. And this also might be because of my personality. I'm very much like a people person and less of a, less of a research person, didn't have a science background, but I really thrived when I got to clinics. It completely changes. So sometimes the people who are really good at the preclinical years, they're really good at studying and taking the tests, are struggle much more when they get to the clinical years and vice versa. Or you could be good at both, but just setting the expectation that, you don't necessarily thrive at everything all at once, and that's okay because we're human. The clinical years are not drawing on like orgo or really even too much medical knowledge. They're much more, how well do you interact with a difficult patient? How well can you manage your time, manage how you come off to other people? For example, impromptu public speaking, which is what giving a presentation is. These are skills that you're not really taught in undergrad. You're taught them, ironically, later on at business school. Like I'm now in literally a class called impromptu public speaking. Wish I had had that before medical school. But yeah, like those are a lot of the skills that contribute to people having a good perception of how you present information, for example, or yeah, just amount of empathy you have towards patients and being able to, get like pudding for them if they're hungry in like the middle of the night, like totally different skill set. But the great news is you can really find a path to success no matter who you are, as long as you play to your strengths and you keep an open mind. Somebody messaged me and asked, what did you think contributed to your difficulty in your first year? Was it study habits or just the amount of content in general? So I wouldn't say that I had necessarily so much more difficulty than anyone else. Like, as I mentioned, I founded this group with 4 other people. One of those people was like the valedictorian of his 50,000 person school. He still failed the same exam that I did. That was a really, really humbling experience because I always was like, oh my God, I'm so stupid. And yet people who were like valedictorians of like Princeton and Harvard, whatever, were still failing the same exam. Everyone was failing the exam, right? Sometimes there's just a lot of content and it's really hard. And it is what it is, right? Like you put your effort where you can and you don't always put your effort in the right places. And you only know that after you took the test, but you can retake the test. Like nothing is the end of the world. At least at Penn and a lot of like similar medical schools, if you fail a test, you just retake the test. I mean, I feel like a lot of people did that and they're all matching in incredible places now. So it's great to see. Yeah, and study habits are something that you figure out over time. It sounds like a lot of you guys might be about to be pre-med or already pre-med, so maybe you've already figured out like what really works for you. That still might change a lot when the content changes. What else? Also feel free to keep, oh, great. Would you advise an undergrad in nursing before medical school? No, unless you want to be a nurse. Nursing is totally different. And the level, I tutor nursing students at the University of Pennsylvania. It's different emphasis, different stuff, a different level. If you want to be a nurse, then you should absolutely pursue that, but I would not do that if you want to be a doctor. Did you do your clinical program during the pandemic? What a great question. Thank you. So I did my 3rd year, January of 2020 to December of 2020. So yeah. So what ended up happening was we lost 3 months right in the middle. And so they pulled us out. I was in the pulmonary ICU when COVID hit. It was really scary. They pulled us out. We were home for 3 months doing like all the didactics, which are the lecture portions of all your rotations. So they generally put them on like every Friday, for example, of every week for a year. So they took all of those, put them into one block. And then we also did like all of neurology online and then just only did 2 weeks of neurology in person. And they cut off a week of a lot of our rotations, which was tough. But, it is what it is. We adapt, we move on. I hated neurology anyways, so I was actually super stoked about not having to do it. Don't tell anyone, but no, it's okay. Yeah, it was an interesting time. Okay, how long was the program in total? So I'm not sure what this person meant who messaged me that. Did you mean my undergrad program or my grad program? I can speak to the MD MBA. I'm doing a 5-year MD MBA. So if you did them totally independently, that would be 4 years of medical school and 2 years of business school. So it'd be 6 years. If you do them at the same school, they sometimes will do what they call a joint degree, even though, as I mentioned, you still have to get through one to then apply to the other. It's technically a joint degree that I'm doing because I was able to cut down a full year. The way that works for me, 3 years of 3.5, 4 years of medical school, full year of Wharton courses. Then I go back to medical school to finish off rotations in the summer and do one final semester of medical school. And then I go back to do one final semester of Wharton. So I effectively graduated 1 semester early from medical school and graduated 1 semester early from business school to make up that extra year. I hope that answered the question. And thank you for continuing to DM me and put questions in the chat. Helps me to figure out what I'm going to say to you guys. Okay, so what do you actually do and learn in medical school? This is an awesome question. So your first year and a half, there's courses in things like genetics, immunology, cancer biology, embryology. These are the things that they kind of consider the basics and the foundational building stones, biochem, which is probably much more familiar to a lot of the people in this room than it was to me. After that, I thought it gets a little more interesting because then you do organ blocks. You'll do a month on GI. You can do a month on hematology. You're actually sort of advancing in your knowledge a little, and it all builds up to clinicals. Then you're in the hospital and you basically spend around a month on every rotation. For example, you could do a month rotating on, as I said, GI. You do like a internal medicine. You might do that for 2 or 3 months, depending on the length of your program. You could do, a few weeks on dermatology, whatever. Generally, like they get the more basic things out of the way first in your third year, like things that everybody does. Pediatrics, internal medicine. You don't generally do more specialized things like orthopedic surgery unless you do them as an elective. And also, this depends on your school. Like my school had everybody do emergency medicine for a month as like a required elective, but a lot of schools don't. And it ends up being a 4th year elective. I knew I was going into psychiatry about halfway through my clinical rotations. And so right when I finished that year, as I came into the next year, I did inpatient psychiatry at the VA. So I worked with veterans. And then I did a month of the bipolar disorder clinic. I'm going to go back this summer and do a month on adolescent medicine, which ends up being very psychiatry heavy, focusing a lot on eating disorders. And then I'll probably do another month of something general just to remind me, how to present. Another question. Would you recommend going, lots of questions, through an MD, PhD route? So to the person who asked me this, it depends what you want to do, right? If you want to be a researcher, then you should absolutely be an MD, PhD, because that's what you do when you're doing your PhD is you join a lab and you're doing tons and tons of research for many, many years. And so I have lots of friends doing the MD, PhD. Penn actually, I think, has like the biggest MD, PhD program possibly in the US. So we have a lot of MD, PhDs, like 30 of them or something. And they want to be researchers. They want to run a lab. Like they're going to be clinicians too, for the most part, but they want to run a lab, is my understanding. What careers can you do straight from medical school? So do you mean without a residency? Without a residency, you can't be a doctor without a residency. So if you just get an MD and then are like, you know what? Nah, not for me. Then you could go to consulting. You could try for something, like healthcare banking, or a health tech startup might be an interesting option for you. I definitely wouldn't propose doing medical school if you're not sure that you want to practice clinically, just because it's so hard, it's so expensive, and it's so many years of your life that I think you really want to take the time to make sure that it's what you really want to do before you actually put all your eggs in that basket. Okay, next question. I imagine that not everyone that opens private practices has an MBA. Very true. What is that process like for those people? Do they work with people who have MBAs to help them with their practices? So this is an awesome, awesome question. A lot of times what happens when people have a private practice is they end up contracting out. So for example, medical insurance and billing is like the biggest headache for a lot of doctors who run their private practice in terms of people that I've spoken to. And you'll contract with a company that'll do your billing. You'll contact with people to do your insurance. You have an office manager who will manage a lot of this stuff for you. For example, you might be not exactly sure what you're doing when you lease your office space in a building. That's a big overhead expense. That's something a lot of people lost money on during COVID. I'm hoping to buy the building that I have my private practice in, because I've seen a lot of people kind of go out of business or really struggle financially based on the high price of the lease and basically the large cost of their overhead as compared to their patient panel. But I would say like insurance is the biggest thing. So I'm really trying to learn about insurance while I'm at business school because it is so complicated. Okay, next question. Would you recommend doing medical school straight from high school, like in countries in Europe? What are the benefits and costs compared to someone who does an undergrad before medical school? Again, is that even possible in Canada? I don't know. This is really hard for me to answer. I'm sorry, because in the US, it is literally not like possible to go from high school to medical school. You have to do 4 years of undergrad to then go to medical school. And it's actually pretty common here to do like 4 years of medical school and then take 1+ years off. I say off, but it means doing research, doing a master's in public health. Like my average incoming age in my class was 25 when I entered. So, and we graduated at 22. So the average person had taken 3 years out of college to then go to medical school. The benefits and costs, who does an undergrad before medical school, again, you might be an international student, the person who would ask me this, but it's a pro and con, because if you do medical school a little bit older, again, you're sure that you want to do medicine, as sure as you can be, right? You've done a ton of rotating with physicians. You hopefully understand a little bit more about the challenges of modern medicine, and that it's not like when your parents practiced. It is not, the big money maker that it used to be. And you'll have your eyes open probably a little bit more. But it's also still an incredible career, in my opinion. But the downside is you're older. So this is something that I think about a lot. I'm a woman. I want to have kids at some point in the next few years. I'm not graduating residency until like 35. So that's tough. And you just get a little bit later start in your life. But I like to think of all the years that I worked as not like wasted time, because that established my career, right? But as time that I spent establishing my career. Any more questions on that? Love the DMs, guys. Keep them coming. If not, I'll dive into the next question that I had. Somebody asked about the medical school application process. So the way it worked was, I think it was similar to college. I think I had like 3 letters of recommendation from various people. I mean, for me, coming from a business background, I used my bosses from my prior companies to write my letters of rec, and a professor that I had really loved as an undergrad and TA'd his classes. And then I wrote a personal statement. Basically, like, I had to explain my story, because they were like, why is this consultant applying to med school, or this health tech person? I explained my story, who I was, what I wanted to accomplish in life. And then it was kind of like the Common App, or that's what we call it here in the US. I think I just sent it, and sometimes they'll have a supplemental question. They'll let you know if they have a supplemental question. Maybe it's a few paragraphs, and then you'll write that specifically for that school. Residency is like actually pretty much the same, with the exception that you also submit step 1 here in the US. I have no idea what it's like abroad, but we have step 1 and step 2 scores, which are like your board scores. Although step 1 just went pass fail, actually. So I don't even really know how that works anymore, but it's basically your board scores, another personal statement explaining like what you want to do in your life and why you're applying to that specialty. And then letters of recommendation usually from doctors in the field that you're going into that you rotated with. For example, like I'm going to have letters from 2 psychiatrists and then an adolescent medicine, hopefully, person, someone in pediatrics. Any other questions on that before I pivot a little bit? Okay. Some of the questions are a little challenging for me to answer. People had asked things like, does it matter the prestige of your undergrad when you apply to medical school? I've interviewed people for Penn, but I've never sat in their admissions committee, so I really can't answer that. I think you go to the college that's the best fit for you. Okay. I know that it's required to TA a class if you're pursuing a master degree at your school. Is it common to have a part-time job during medical school? Nope, very uncommon. I don't know that I've met anyone at all who had a part-time job, with the exception of my one friend who is a 4th year at Michigan, who was a bartender like 1 weekend a month. it was not really for the money. It was more to blow off steam because she did it like literally 4 hours a month. The reason people don't have a part-time job too frequently, and there's some exceptions, is just because of the time. It's really, really a lot of time. And at least here you can't like TA per se as a medical student. As a fourth year, there's opportunities to make a little bit of money if you like, for example, like I tutor a first year, people will tutor a first year, they'll tutor someone else. They will, I hesitate to call it TA because it's not the same as TA, but we have like a doctoring course that you can be a coach of. I don't really remember the right word. Maybe they call it TA, but yeah, there's a few opportunities when you're like done with everything. If you could go back and change anything about your med school and business school journey, what would it be? Oh, what a great question. I think I would stop worrying so much. I was so stressed out my first 2 years in medical school before I had figured out that I was going into psychiatry, before I figured out that like I was going to achieve the things I wanted to achieve and I was going to be okay. I was just so anxious about like not being good at school because I'd always been really good at school. And that was like, I realized at the time, like maybe too strong a part of my identity. And I would say that that probably shouldn't be a strong part of your identity at all, right? I relearned to define myself by like my passions and my interests and how I treated other people. And that's still something that I very much define myself by now. Otherwise, medical school can really do a number on you. So yeah, I just wish I was less stressed out, particularly that first year. And now it's so amazing because so many of the people that I saw and that I've gone through this journey with are now, they've just finished all their residency interviews. People who I remember failing like literally every single test for a 2-month span, just wrapped their interviews at like Harvard and Stanford and will go to one of those programs. So like, it's so inspiring to see my friends who have come so far and just like accomplished so much. And we all stressed out so much and yeah, wasn't necessarily worth it. What else? Somebody also asked me that question about high school. Like if you could tell your high school self anything, what would you tell your high school self? I would tell myself the same thing. Don't think so far into the future. Calm down. You're going to be totally fine. Believe in yourself and just keep a clear image of who you are and staying true to your values and what you want to do. So like for me, when I close my eyes and I think about like, what is it that I want to accomplish in this life? For me, like a big thing is women's mental health. Like that's what I'm here to do. And so no matter what residency I end up at, no matter how it shakes out, as long as I'm like getting to that goal and I'm furthering women's mental health, I'm going to be happy. What else? I think I may have covered all the questions. Do we want to open it up? Maybe other free questions that anyone has? If we don't, we could probably wrap a little bit early, but I want to give you guys time to ask any questions that you want.
Okay. I have a question.
Sure.
So I know you medical at the University of the US, and I think a lot of my friends want to like study in the US, and I know it's really difficult to medical school. Wondering if you know of any like Canadian students.
I think your internet connection might be a little unstable because I had trouble hearing you. So I'm so sorry to cut you off.
Who are currently. Oh. Do you want me to repeat the question again?
Can you just type that? Actually, if everyone could type it, that would be great. Because your internet was also, I think what you said was, do I know any Canadian medical students here? Because it can be really difficult to apply from Canada. Is that correct? Okay.
Yeah, that's basically what I asked.
Okay. Sorry about that. I do. She applied from Canada. I have no idea about her process, but there is a Canadian medical student in my class. Yeah, I think that's all I can say. I don't know how her process was. I wish I could help more with that question. I'm guessing it's more common for Canadian students to probably stay in Canada, if I'm right. But yeah, I guess it would just be like an international applicant, like anywhere else, if I had to guess. I got 2 other questions. Okay. This person is staying in the US. Her mother is a practicing doctor in the United States. So I don't know if that changes things, but she's currently applying to US residency and planning to stay in the US. Okay. How did you know it was going to be psychiatry that early on? So I knew I wanted to do women's health based on the research that I did as a senior in college. I just felt so drawn to it. I thought perhaps I was going to be an OBGYN. When I actually did my OBGYN rotations, and by this point I had done medicine, I had done surgery, I realized I am not a surgeon. OB-GYN is like at least 50% surgery. Like, they are surgeons. So much of what you do is doing, for example, a hysterectomy or taking out a cyst, taking out maybe fibroids on a uterus. It's very surgical. It's very hands-on. I enjoyed, learning to work with sutures and do my knots and all that stuff. But at the end of the day, the defining moment for me was when I was with a woman who was in birth. And I found that the other medical students were at like the base of the table, like doing sutures and delivering the baby. I was up top with her talking, just basically doing like motivational speaking almost, and trying to get her through the challenging time. And I thought back on that experience and I said, I think I need to do something that really centers on talking instead of doing. But you figure it out. Really, everyone changed what they wanted to do from when they came in. Nobody knows. So don't worry about that. You do your rotations, and that's the whole point of rotations, for you to learn what you want to do. Do not worry about that at all. Somebody messaged me saying, what are your thoughts on Ivy League schools for med schools? Can you clarify that a little bit more? Do you mean like which Ivy versus which Ivy? Do you mean going to them in general? I actually only applied to one medical school. So that's a little bit odd, but I applied early to Penn, and I didn't apply to Penn so much because it was an Ivy League. I applied to Penn because I went here undergrad. I knew that it was a great school. I knew the research environment. I liked the faculty. I liked the location. I knew where I was going to live. I had friends there, like other factors. But I definitely wouldn't like fully base your decision on whether it's an Ivy or not. I think you could be really disappointed just because the schools are also different from each other, right? Like Penn is totally different school than Brown or, places like that. So you want to think about what's a good fit for you. And like a big thing is location. If you care about that, where's your family? Do you want to be close to your family? Do you like warm versus cold? For me, like I looked at, I almost really went to Chicago. I really liked it. I did all their tours and everything. I thought it was great. And then I remembered that I become a popsicle in under 25 degrees. I know I would not survive in Canada. Sorry, guys. Fahrenheit. Sorry. I don't know Celsius, but basically I hate the cold. And I realized Chicago would be a terrible fit for me because it's so cold. Just things like that. And I will say, like, it is easier to go to residency in the geographic area that you're from. So like, this isn't necessarily the case for everywhere, but my experience just seeing my friends is that, like, for example, if you knew you wanted to do residency in New York City, it's helpful to go to med school in the New York metro area, because then they'll have heard of your med school. You could do a rotation there, things like that. Versus for me, I'm applying to some California schools most likely and some Florida schools. they will be like, why is this random person from Pennsylvania applying? I'm guessing. I don't have residency or like ties to California or Florida. So I'm going to have to basically explain myself in those interviews if I get them, to say like, hey, here's why I'm interested in Florida. I have family here, blah, blah, blah. Okay. Do you think you got a better education and more learning opportunities because you went to an Ivy League for undergrad and med school? I don't think so. I mean, it's really hard for me to say. I definitely am not going to sit here and say like an Ivy is like so much better than another school. Like, I think it's something that probably people's parents tout on a lot, but at the end of the day, you go to the place that has the best opportunities for you. I got incredible opportunities at Penn throughout my education. So that is Penn specific and not Ivy specific, right? Like, I had friends who had unbelievable opportunities at Michigan State and University of Michigan and Boston University, Boston College, Tufts. Like, I'm from Boston, so I'm saying a lot of Boston schools, Brandeis, like unbelievable opportunities. So no, I think college is what you make of it. Med school is what you make of it. Obviously, if you go to a med school with lots of teaching hospitals around it, like the way Penn had like 6 different hospitals for me to rotate at, I got more exposure, more opportunities. But I think like Ohio State could be a good example of like, they have tons of hospitals too, you know, Michigan, like tons of hospitals, tons. What else? Loving the questions, folks. Maybe I'll give it like 1 or 2 more minutes. Oh, okay. Are you planning on opening your practice in Pennsylvania or somewhere else? I think in my mind, somewhere else. I'm engaged, so it also depends, honestly, on where my fiance ends up, and where there's careers that, you know, allow him to do his job. I don't think it'll be Pennsylvania. He's from New York, so potentially New York, but we'll see. What do you think of, this is a weighty question, my dear. What do you think of the American healthcare system? Do you plan on staying in the US under the current healthcare conditions? Somebody needs to go get a healthcare management MBA to talk about this, because this is what we talk about all the time. It's really messed up. For those of you in Canada, I can't comment, but I'm sure it's less bad. Healthcare is so expensive here. I need a procedure and I think it's going to cost me $8,000, and it's like not even a major procedure. Yes, 8,000 US. I don't know what Canadian dollars are. Things are incredibly expensive. They can bankrupt you. You have to be quite crafty about like the healthcare you receive and how you choose to pursue care. I hate that. And I hate that I will have to exclude a lot of patients from my practice, at least early in my career, because of their insurance. Because the truth is, some insurances are so bad here, although this is changing, that they don't cover mental health. And I, as a physician, can't change that. I can take some pro bono patients, but I can't change everybody's insurance, right? So that really frustrates me. But am I planning on leaving the US? At this point, no, because my whole family's here and my fiance's here. I'm hoping to innovate from the private practice side, or from the private sector, as opposed to innovate from necessarily like within a hospital system, although maybe both, to get costs down and to make care more affordable and accessible. That's one of the reasons that I love like the digital mental health space. Apps like Talkspace, Headspace, Ginger, these are bringing like affordable mental health care options to all. And ultimately, my goal is for everybody to have access to mental health. So yeah, trying to just work within the confines of the system. Thank you for that question. How does the health insurance work in the US? Does the government offer any insurance plans for free? We do have Medicaid, which is reduced cost health insurance for people under a certain income threshold, as well as Medicare, which is basically, again, reduced cost health insurance and certain benefits for people over the age of 65. But no, insurance isn't free. It's extremely expensive. I think an average plan might be like $4,000 to $5,000 a year on top of a deductible. So your deductible could be like 5 or 10,000 a year, depending on the plan. The plans vary a lot. You could have a plan with no deductible, for example, where you end up paying out of pocket. And this might be a more popular option among younger, healthier people, or people who perceive themselves to be at less risk of a major medical event. A lot of insurance tends to be offered through your employer. So they'll say, like, we have Aetna Premium Plus. This is what we offer. Take it or leave it. You have to take it though. And then it's, you pay $3,500 a year and you get X amount of things covered. Oftentimes what they do is cover a portion of your medical costs, like 20%, for example. What else? Sounds terrible. He said, yeah. Healthcare in the US is like really messed up. It's pretty bad. But there's also a ton of private sector innovation happening because of that. So we think about that a lot. Okay. Do therapists recommend their patients to see psychiatrists? Okay. So I'm going to like quickly do some definitions. Therapist, oftentimes a psychologist. This is a person that did not go to medical school. They studied either a Master of Social Work, they did a PsyD, or they did a PhD in psychology. And then psychiatrist, went to medical school, you're a prescriber, you then did your residency in psychiatry, so you're interested in behavioral health, but from a medical lens, so you tend to prescribe. Therapists can absolutely recommend their patients go see a psychiatrist. How do patients know? A lot of times the referral can come from your PCP, so your primary care provider can say that I think a psychiatrist might be a next good move for you. And a lot of times patients themselves call up a psychiatrist because they think, I'm really struggling with my depression or anxiety. And I think that this is something that would be best served not only by talk therapy, but by medication therapy too. And another thing is that psychiatrists do psychotherapy. So that is talk therapy as well. So you can see a psychiatrist, be prescribed meds, at the same time do psychotherapy with them. Okay. You mentioned earlier you would talk about how you're a clinical advisor to small companies. Can you elaborate further? I'm going to caveat this by saying, like, my technical title for the startups that I'm doing this for at Wharton is clinical advisor, but really a real clinical advisor is an actual doctor. I am not a doctor. I am a medical student. So I'm a clinical advisor as my like intern title, only in the sense that what I do is basically distill all the research coming out in the space. Menopause is one, for example. I look at research in menopause. I look at nutritional research and think about things like recommended doses of vitamin D and how can we best tell our patients to do supplementation with food. A lot of it's reading white papers. It's things that are not that challenging to do after going through medical school, but true clinical advisors, because this is a real job that like MDs do all the time. And a lot of my mentors absolutely do. And they work for startups. I know a lot of them in New York City that currently do this, and they basically are scientific advisors. So the company could come to them and say, like, we want to work on teen mental health. Like, what are your thoughts on like which medications are safe, which antidepressants are safe for teens to take? That could be like a really reasonable question to ask a practicing psychiatrist. One should ask a real psychiatrist that, not a medical student. But yeah, so I read a lot of white papers, I distill information, and I also help people at Wharton think about what the healthcare industry looks like from a provider side. So like, what does the patient journey look like? I'm consulting for a big insurance company right now, and I help them think about, from a psych patient perspective, what does their whole journey look like and where could we insert ourselves in that process to make it smoother? I hope that answered the question, Anushka.
I have a question. A couple questions previous to this one, you explained the difference between a therapist and a psychologist and psychiatrist, excuse me. I'm the leader of our school's newspaper, and I've done some interviews with a couple of psychologists and psychiatrists, and I've asked them what's the difference between these two titles, and they all answered me in a way that shows that psychologists are talk. They speak with the patients, they discuss their mental issues with the patient's mental issues, while the psychiatrist prescribes medicine to the patient. Do you agree on these definitions, or do you have other opinions?
So I agree and disagree. I agree that those are both things you do, but psychiatrists also do talk therapy. So you are, depending on what residency you go to, you must do psychotherapy training, and you often do psychotherapy with your patients. You don't have to. For a psychologist, that is your whole job. So you have to do psychotherapy, right? But there are psychiatrists who don't, but a lot of psychiatrists went into the field, myself included, because they wanted to do psychotherapy. So they wanted to do both, right? So yeah, you can do both as a psychiatrist. You also do a lot more management of people. As an MD in general, and this is the way the field is moving, you're managing a really large team. This is one more reason I wanted an MBA. You're like, my psychiatrist that I worked under at the VA, for example, managed a team of like 30 people when it came to residents, medical students, nurses, PAs, scrubs, like, you know, all the people that like come up under them and need their ultimate final say opinion. It's a lot of management versus a psychologist isn't necessarily managing a bunch of people. Maybe they'll have a precepting student with them, but they're really more focusing on just that patient one-on-one. So yeah, it can be a very different relationship depending on the practice setting you're working in.
I was told that also psychologists do not go to medical schools, while psychiatrists go to medical schools. Is that true?
Yep. So a psychologist is a master's level profession. It is not in the medical field at all. So like if you wanted to be a psychologist, you would go and get, again, in the US, it could be like a PsyD is a common degree, or you could also go to social work school. A lot of social workers become a licensed clinical social worker and have training in therapy. And can open up a therapy practice. Or alternately, there's people who get a master's degree in marriage and family therapy. So just any sort of master's level degree, as opposed to a medical degree is a doctorate degree, and it's a very specific MD, or there's also DO in the US. I don't actually know if you have that in Canada. No. Okay. So MD.
Yes, thank you.
You're welcome. I hope that was helpful. Okay, guys, I think we're at time. I have to go, but are there any final questions that I can answer before I run? It was so great to meet you all today. And I hope I was helpful, and good luck in your journey. So impressed that you guys are thinking about your career in such a thoughtful way at your age. So good luck with everything.